Hi, this is Nick Walters from Mission Hospital Bangkok. I'd like to talk to you today about respiratory infections while you're traveling. Respiratory infections are very common, one of the most common infections that people get, especially when they travel. In fact, next to diarrhea, it's the most common infection that travelers will get. Respiratory infections can be caused by a number of different things, the most common being different types of common cold viruses, and there are thousands of these, but they can also be caused by influenza viruses. Now, if you have a respiratory infection, such as runny nose, mild sore throat, there's no fever, a little bit of cough, you probably have a common cold, and the main thing you need to do is get plenty of fluids, get some rest, don't party too much while you're having this respiratory infection, and after 3 or 4 days it should improve and get better on its own. However, if you have fever, body aches, chills, headaches, you feel sick, you need to see a doctor, because this kind of infection could be influenza or some other more serious infection such as bronchitis, pneumonia. With influenza, often there's an associated cough depending on the type of influenza. Influenza is treatable. There's a particular medication for influenza, and for particular people, especially people with respiratory illnesses such as a history of asthma or heart problems or small children, it's important to see your physician. If you develop symptoms similar to influenza, see your physician. We can check at our hospital. It takes about 45 minutes to get the results of an influenza check, and if you do have influenza, we can give you treatment right here. Also, it's important to be managed and followed up if you develop influenza to make sure you don't develop any of the complications of influenza, such as bronchitis and pneumonia, which are more common in people with a history of respiratory problems, more common after age 60. The best way is actually prevention, and prevention is accomplished through getting an influenza vaccine. Also, there is a pneumonia vaccine, sometimes called the pneumococcal vaccine. This vaccine is available at our hospital as well as the influenza vaccine, and it can prevent you from getting pneumonia due to the most common cause of pneumonia, which is Streptococcus pneumonia, which is a particular bacteria that can cause very serious infections in the lungs. It can also cause an infection going to the brain and the ears of children and other problems, and this is preventable with the vaccine. A third way that's very important for preventing respiratory infections is by washing your hands frequently, especially if you've been in a crowded area. For example, if you've been traveling on a bus or a train or a plane, please remember not to rub your nose or your eyes. Wash your hands frequently, certainly before meals, after going to the toilet. Whenever you've been out from a crowded place, such as out in a place where there are many people, before you eat, when you first come back to your hotel room, wash your hands thoroughly. This will help you to travel well.